Have you ever tried to give a pain or fever medicine to an infant? I mean, little infant, like 6 months, 9 months, year old. They do not take medicines very well. These suspensions, acetaminophen and ibuprofen, are thick, they're syrupy, they're hard for babies to take. So sometimes you have to squirt it in their mouth very slowly. Maybe you're using this dosing syringe. They're gagging, they're not swallowing it, they're spitting it out. Maybe they do swallow it and 2 minutes later they throw it back up because it was too much, too fast. Well, I have a recommendation for you. So if you're using acetaminophen, instead of using this thick syrupy suspension, you can use a rectal suppository. This is what I do for my kiddos. If you're using ibuprofen, instead of the children's ibuprofen, get yourself the concentrated infant's ibuprofen. What they do is they put more medicine in a smaller amount of liquid. So instead of giving maybe 3 milliliters of this one, you only have to give 1.5 milliliters of this one. It's just a smaller amount, and the baby is able to tolerate that smaller amount better. So if you're ever confused, what dose do I use? Get the pain and fever dosing guide for infants and children. This is available on Amazon. I wrote it along with my sister. We are both pharmacists and mothers, and we keep this in our medicine cabinet. So what you can do is look up acetaminophen. So if you're using the suspension, great. You can say, okay, I'm using the acetaminophen suspension. Go down, let's say your kid's 15 pounds, and you find the exact milliliters you give of the suspension. But if you need to use the rectal suppositories, you just find the page that has acetaminophen rectal suppositories. And it says if your kid is between 12 and 17 pounds, which a 15-pound kiddo would be, you give 80 milligrams, which just so happens to be the exact dose of one suppository of this product. If you're using ibuprofen, you go to the ibuprofen tables, and we have 2 tables. We have children's, it's orange, it matches the children's ibuprofen labels over the counter, and you find 15 pounds, and you find that at 15 pounds they need anywhere from 1.8 to 3.4 milliliters. Maybe that's just far too much, but if you use the concentrated infant's ibuprofen, and you find infant's ibuprofen over here, you find instead of giving 1.8 to 3.1, you're only giving 0.9 to 1.7. So you're giving essentially half the amount in volume to your child to get the exact same dose. So this is highly effective. This is very, very good to have in your medicine cabinet. And these are just 2 recommendations to help get that medicine in your kiddo when they're not feeling well and you know they need the medicine.